I love the practice of anesthesia. I think nurse anesthetists are some of the most dedicated medical professionals you have out there. As a provider, we're educated to provide all forms of anesthesia in any location. We're not just in the operating rooms. We are in x-ray, we're in pediatric facilities, we're in areas where you have your colonoscopies and your endoscopies. We can practice anywhere that you will give us the equipment to work with, and we are there to take care of you.
There is a workforce shortage for anesthesia. The word supervision creates a barrier. If all anesthesia providers work to their full extent and we allow them to work independently, the workforce shortage would decrease.
Physician supervision is required here in Virginia, so that creates some barriers and restrictions to our scope practice on a daily basis, affecting our patient care and service to our community.
I've received questions like, how can I supervise a CRNA? I'm not an expert in anesthesia. How do I know if you're doing the right thing? We've had to reassure them and let them know that, you will receive the same quality of care that you would get in the larger hospital. It's just being delivered by a CRNA independently.
We have a Virginia CRNA who is an expert in regional anesthesia. And he's working in a hospital that requires supervision. A new physician anesthesiologist shows up, he doesn't know how to do regional. So now this CRNA is training the person who is supervising him. This makes no sense.
The supervision role in the state of Virginia really potentiates the staffing shortage. If everybody was working and actually administering anesthesia for their own cases, we wouldn't have a shortage of anesthesia providers.
Mandatory supervision prevents CRNAs from being completely utilized effectively to maximize the number of patients that receive anesthesia.
I think there's always an underlying perception that because we come from a nursing background that our training is less than a physician anesthesiologist. In reality, CRNAs, physician anesthesiologists, trained in the same institutions, sometimes right next door to each other in the same rooms, using the same textbooks, and often are challenged with the same types of patients during their training.
One of the things that we have been trying to stress throughout the state and also throughout the country is the safe, high-quality, cost-effective ability for CRNAs to work without supervision. You're paying one provider to provide the kind of care that is exceptional without having to include another provider who is frequently not even in the room.
Removing the word supervision would allow hospitals more choices. They would be able to utilize a CRNA-only model or a model where all anesthesia providers work in operating rooms and actually bring more people to the workforce in order to fulfill their needs.
Inside of healthcare, when you use that word supervision, it creates this perception that I need to be managed and or that I'm not an expert. It's a dichotomy, being an expert and needing to be supervised. It doesn't make sense.
We are anesthesia experts. We are CRNAs.